They called it the smell of death, sweet, metallic, impossible to wash away, and it followed surgeons everywhere they went. In the middle of the 19th century, surgery was a gamble played in blood. Operating rooms echoed with screams, not silence. Surgeons worked fast, coats stiff with dried stains from previous patients, believing speed, not cleanliness, saved lives. And yet, again and again, patients survived the knife only to die days later. Fever, pus, rot. No one could explain why. In 1867, in Glasgow, Scotland, a quiet shift began, almost unnoticed at first. Joseph Lister, a reserved surgeon with an unsettling habit of questioning tradition, watched his patients die not on the table, but afterward. He studied wards where fractures festered and amputations turned fatal, and he wondered, what if the wound itself wasn't the enemy, but something invisible within it? At the time, the air was blamed. Bad air. Miasma. Death carried on foul smells, but Lister had been reading radical new ideas about tiny organisms, things too small to see, spreading decay. If they spoiled food, what if they spoiled flesh? Here's the first rehook. Lister didn't start with a miracle. He started with doubt. He began spraying carbolic acid into wounds, onto instruments, even into the air. The smell was sharp, burning the throat. Nurses complained. Colleagues mocked him. Some said he was poisoning his patients. But then something happened that made the room go quiet. Patients stopped dying. Compound fractures that once guaranteed infection began to heal. Amputation survival rates climbed. The dreaded ward fever faded. Where there had been pus and stench, there was clean tissue. Calm, recovery. The tension rose as word spread. Surgeons resisted, furiously. To accept Lister's method meant admitting they'd been killing patients for decades with dirty hands and pride. Many refused. Others tried halfway measures and failed, declaring antiseptics useless. Then came the emotional turning point. In hospital after hospital, surgeons who fully adopted antiseptic surgery saw the same result: survival. Over and over. Death rates collapsed. The invisible enemy had a name now: infection, and for the first time, medicine could fight it. By the end of the century, surgery was transformed. Gloves, sterilized tools, clean operating rooms. The age of reckless cutting ended, replaced by precision and care. Not because surgeons became faster, but because they finally learned to be clean. And here's the reflection that lingers. Modern medicine wasn't born from a new blade or a stronger drug, but from humility, the willingness to admit we couldn't see everything that mattered. If this story changed how you see medicine, history, or the unseen forces shaping our world, support the channel by liking, sharing, subscribing, and leaving a comment. Your voice helps these stories keep reaching the light.